Welcome, class, to the Auburn University Medical Clinic. We're guests today of the Medical Director, Dr. Fred Cam, and massage therapist, Terry Gilmore. Dr. Cam, can you tell us a little bit about this facility?
So you would consider this the on-campus student health center, but we're a little different in our model. First of all, we don't charge student health fees, and we're not supported by those. We're a fee-for-service operation, just like a private doctor's office. So we bill insurances, collect co-pays, deductibles, all those sort of things on the business side. In addition to that, we don't just see students. We see faculty and staff, even people from the community who, again, come here for their primary care and urgent care services. One of the things that we pride ourselves in is how patient-centric we are. And when we were putting this model together, we wanted to have not just your traditional medical model, we wanted other options available to our patient population, and one of those was massage therapy. So that's what we've worked to do. We brought the massage therapists on board, and we're thrilled to have that as a therapeutic option.
Well, that's very interesting because, as you well know, integration of alternative medical practice is relatively novel. So how well has this been accepted and utilized in this facility?
It's actually been very well received. You know, again, in today's world, patients are capable of researching and looking at other options. Many of them don't want your traditional medications as their therapeutic options. So they're looking for alternatives, and they deserve alternatives. And fortunately, my team and I are very open-minded to all the different options that are available. You know, again, we're looking at possibly bringing on acupuncture next. We have an osteopathic physician on our staff, so we're not just traditional allopathic. We're venturing beyond those boundaries. So again, very patient-centric, that's what we are.
That's really interesting, a patient-driven center.
Yes.
This is very novel. Thank you so much for having us today.
Well, thank you for being here.
And I'd like now to introduce Terry Gilmore. Terry is a licensed massage therapist here at the clinic. Terry, tell me a little bit about your academic and professional preparation.
I attended Montgomery School of Massage Therapy 14 years ago. Following that training, I have attended many CEU classes, which also equipped me with different modalities that I do now, more toward the medical field.
Now, this facility has been available for 8 years, and you've been practicing for 14, so what other experiences have you had?
I owned my own practice in Wetumpka, Alabama before moving here.
Now, tell us a little bit about the laws that regulate your field of expertise, national, state, local.
We choose in my office to follow HIPAA rules, which means we are private. We don't discuss different situations with different people about our patients. We are also, as massage therapists, required to carry liability insurance for liability insurance purposes, and that ensures our licensure.
Are there any scope of practice limitations that you're very careful to observe in your profession?
As for recommendations from the physicians, we only follow what we are trained to do. We don't go out of our scope of practice.
Okay, well, we're really looking forward to your demonstration of your techniques today. Thank you so much for having our class.
Thank you. This is Jen, our associate, and we're going to demonstrate chair massage. Chair massage is perfect to be utilized in public settings because you can remain fully clothed, yet the therapist can work on neck and shoulders and back effectively. As you can see, the advantage of having chair massage is her face is comfortably in the cradle, her neck is in line, her shoulders are comfortable, and her back is elongated. So in chair massage, the perfect place to begin is at the base of the occipital ridge, and then maybe add in a little neck, some trapezius, a little rhomboid, some latissimus dorsi, and you can include all of that effectively in chair massage. It's also great with headaches when people have tension headaches because you can access the entire scalp from this position. Chair massage is very beneficial because a lot of people are reluctant to be on the table setting, so it's very relaxing. Here we have a muscle chart. It helps us to realize where the muscles actually originate and insert. As you can see, the occipital ridge has many muscle structures that go and attach there. We're going to discuss several of those as we start our massage process. Also, you can see the lower back and how all of the fibers get thicker here. We're going to talk about fascia and how the fascia binds itself together. So this is a great example where the latissimus dorsi comes down and attaches. It all gets thicker and tighter. With most massages, we go ahead and begin with some essential oils. Essential oils are important for relaxation of the client. Actually, one of the most favorite and popular essential oils is lavender. A lot of people find that to be very relaxing. As you can see, I am massaging gently the occipital ridge. We spoke about where muscles attach in this area. This is one of the important spots to pay close attention to if people have headaches. Sometimes the restriction in the occipital ridge actually can be one of those origins of a headache. We'll talk soon about trigger points. One of the trigger points that can trigger a headache is actually located behind the ear. Its referral can be all the way around the ear and to the front of the eye. This is important to go ahead and get loosened up, and if you are prone to have headaches, this might be an area you want to research and try and get a little bit more loose through stretching and massage. Now we're going to go a little bit further down. One of the muscles that attaches at the base of the occipital is actually the trapezius. The trapezius is otherwise named the trap, and that is one of the common muscles that does exactly what its name is called. It traps. It traps stress, it traps tension, and it also enjoys trapping when we have poor body mechanics or posture. Now I'm using a hypoallergenic massage cream, and a lot of therapists like to use oils or lotions because they warm very well and they have a nice glide. Cream is just my choice because I can control it better, and later when I demonstrate one of my modalities, you'll understand why control is important. So from here, the area that I am working on, doing a little, this would be cross fiber friction, working a little bit cross fiber friction on the levator scapula. That is the little tiny muscle located at the very medial portion of the scapula, and it actually runs and attaches itself at the base of the occipital. The interesting part about that particular muscle is if you happen to sit with your elbows propped on your chair, or to use the telephone, or to drive, the tendency is to raise your shoulder toward your ear when doing that. That creates more tension in the muscle and therefore binds the fascia. Now moving down toward the lower back a little further. Subscapularis is another area we find tension in quite a few people. Mr. Subscap likes to get involved in a lot of different situations. If you happen to sit at your desk, or you study, or you drive with your hands and arms forward, puts tension in the subscap, and it can create a binding of the fascia as well. This is a good point to work on a trigger point. Trigger point therapy is using a more pointed therapy where we would find a trigger point. Trigger points follow the nerve pattern. So this particular trigger point could possibly follow all of these muscles and actually end at the base of the occipital ridge. There is a section of the shoulder, the deltoid, that actually, once restrictions in the fascia are cleared, can assist with common problems that we all have from time to time. Carpal tunnel. If you use a computer, if you write very much, carpal tunnel is probably in your future if you've not experienced it yet. The nerve that runs through the elbow can also trigger that. Some carpal tunnel points for trigger release would be some on the interior of the arm, some on the exterior of the arm, and then you work on down to the hand. And we would do some stretches. We would also teach the client how to stretch at home for this particular problem. That would be some of the release and stretch. All of these are excellent for anyone who computers or writes very much at all. And we'll come back to the back again. Myofascial release is a commonly used term that just means that you are bringing oxygen and circulation to the specific muscle group, usually using broad strokes. This would be effleurage. But more specific, we will go with the muscle fiber. And then we'll work with the latissimus dorsi. We'll go across fiber friction. And we can address her shoulder and her low back all at the same time. If you had an expecting mom, this would be an area you would not want to address. If they are making an attempt to conceive, the low back, the sacrum, and the pelvic area is also a place you would want to refrain from. It is good for pregnant moms to get massage therapy. Helps to relax them just as well as any other patient. The area I'm working on now is an area that also is problematic for people who have been in car accidents or have had experience with whiplash, the upper back, the trap, all of this area can be problematic because the neck has served as kind of a bungee cord or an accordion to try and stabilize the head during accident. Here we have her low back and the side of her hip. Many people have trouble with their low back because of car accidents. There again, possibly where they have had their foot on the brake or the accelerator during impact. Also, the low back is a problem when you have a tummy area that gravity is trying to keep compensated on the front side. You have loose abdominal muscles, pulls on the low back area. You have a tiny little muscle that attaches at the side of the hip called the piriformis. Piriformis also attaches on the sacrum. So if we were to do cross fiber friction on the piriformis, that would assist in relaxing that. We could also come back to the sacrum. You have a lot of nerves that come out of foramens in the sacrum area. This is also a really great area to massage, but of course, there we go again, not for a pregnant mom. Some people have trouble with sciatica. The sciatic nerve actually runs from the low back area under the piriformis, which is here. So it can get pinched under this little bridge. So when people come in with sciatica, or what we consider to be pseudosciatica, we would release and do cross fiber friction, maybe a little deep tissue massage on the piriformis to actually help to relieve the sciatic. And then some of the sciatic nerve actually is here at the ischium, and then it meets up with its friend Mr. Hamstring. Okay, so when you have, obviously when you have low back trouble, a therapist would need to work both sections. Cross fiber friction, allowing the oxygen and the blood flow in to be able to get optimal low back release. Also stretching, doing their homework, showing them how to stretch is all a part of massage therapy and doing our job. Okay, the lower leg and the foot are very important because they help carry the weight of the remainder of the upper part of the body. The calf muscle, also known as the gastrocnemius, is made up of several different muscles. It can all get very tight, especially with runners or with people who actually wear heels that are too elevated, or if you do not wear the proper shoe support, the calf muscle can also get very tight. Another area that we like to address is the Achilles tendon. Everyone is familiar with that. And then we come to the foot. The areas that I'm working currently are ones to be avoided during pregnancy massage. Just under the ankle bone and interior just under the ankle bone. Also, the bottom of the heel. Those would be avoided. Everything else is pretty good. With pregnancy massage, you just do pressure that would be what you would commonly use applying lotion to your own body, being non-specific with your motion. Reflexology is a very interesting part of massage therapy. the foot is mapped out as the body would be laid. So in the toes would be the head. And you come on down, you have neck and shoulders. You begin with the digestion system, stomach, intestines, liver. You follow on down, you get to the low back, just like the body is mapped out. All of those points are really important. There again, important to wear good supportive shoes to keep your feet and legs healthy too. Ashiatsu is another modality often used when the therapist needs to use a broader, deeper pressure. We spoke about deep tissue earlier. Deep tissue would be more specific if using your hands, where Ashiatsu can actually be deeper and cover more fascia at one time. I'm actually using my feet to go over her traps, her levator scapulae, and her subscap all at the same time. I can also do that with a different technique where my heel uses a little deeper pressure and is more specific to help the fascia fan out, gain more blood and oxygen to that particular area. Most of us have pain and stress at some point in our upper back, so this feels really good to a lot of people. I can also place both feet on her traps. I can pull the occipital ridge with my heels. I can push on the traps and stretch her neck a different way by pulling gently on the occipital ridge. With one-footed Ashiatsu, I can place my foot the entire side of her back, moving it slowly up the fascia, my toe being the guide. See how much pressure I'm using, the indention of my toe. Go to the border of the scapula. This feels really good to the client as well. My heel can end at the trap, and I can come backwards, go across the fiber of the muscle, to the iliac crest. In this shot, I'm going to demonstrate table tie. Table tie is designed to use compressions. Compressions help restricted fascia to become a little more loose, space between the striations. Table tie was implemented because actual Thai massage takes a very long time. Common table tie session could take as much as 2 hours as well, just like Thai massage, but it is the compressions that makes the difference. In this particular situation, I'm going to implement the hot stones. We have the stones warmed in the crock pot, actually is what we use, They're held at a perfect temperature. For example, if I can hold them comfortably in my hand, then they're okay for the typical individual's back. So I'm going to begin with the low back. Hot stones are used to warm the muscle, help it to be a little bit more cooperative with the actual massage, especially if there is a trigger point or a fascia that is bound. The hot stones can help release that, and it feels really great to the client. Scapulas of the borders, there again, are problematic. They especially enjoy hot stones on them. Okay, Japanese facial massage is the first thing I'm going to demonstrate with her face up. It's excellent to use when people have headaches. Some reflexology, trigger point therapy can be used on specific points. And then also from here, we would do a little lymphatic drainage. Everyone suffers from a cold at some point and sinus pressure. So with lymphatic drainage, we would open the lymphatic garbage cans to begin with, and then work in a wave-like action, very light pressure, and bring that congestion downward. It's very light, very slow. I'm actually more speedy with this demonstration than I would be ordinarily. Just trying to help the lymphatic system bring what is in the sinus cavity down to disperse out of the body. The lymphatic system is a storage area for impurities in the body. Therefore, it needs to be cleaned out effectively, especially if someone has lymphedema or has undergone cancer. They can receive lymphatic drainage. From there, I'm going to stretch her neck just a little. We're going to work on one more section of the neck. And I will show you a little bit different technique. Neck muscles are very important to keep limbered. We work the entire area of the neck, front, side, and back. And we bring it down to include the trap. And we work all attachments, including the belly of the muscle.
Terry, thank you so much for allowing our class to come to your practice today and observe your techniques and your expertise. I did want to ask you one question about Swedish massage, because the book does talk about it and how popular it is, and you demonstrated some different techniques today. So what are your comments about Swedish massage?
Swedish is more of a gentle, flowing massage, specifically done mostly for relaxation. When people don't have any particular aches or pains that need to be dealt with. I showed a lot of techniques today with specifically medical massage and a lot of different techniques that can actually be used to reduce pain and stress, where Swedish is a lighter, less invasive. A lot of people choose, but we range everything from that all the way up to the deep tissue, which is very intense.
Okay. Well, thank you again so much. We really appreciate it.
Thank you.
This was a great trip for the students.
Thank you. My pleasure.